This video will discuss what to do if you find the area of greatest restriction is below T12. If you find the area of greatest restriction is a vertical unilateral band along the lumbar spine that is worse with standing and improves with sitting, then you want to screen the lower extremity for the area of greatest restriction.
We can check hip flexion, external rotation of the hip, internal rotation of the hip, external rotation modified Faber's test. For hip, we can check motion of the fibular head, checking for dorsiflexion of the foot, plantar flexion of the foot, and spring the arch of the foot. Restriction here would lead you to investigate the metatarsal bones and bones of the foot more specifically.
If you find the area of greatest restriction is greatest near the SI joint when springing, and that this restriction is greater than that in the lumbar segments, then you want to screen out the sacrum and pelvis and treat the key lesion. If the standing forward bending test is more positive than the seated forward bending test, think iliosacral or possibly lower extremity dysfunction. If the seated forward bending test is greater than the standing forward bending test, then be thinking more of a sacroiliac dysfunction.
So when screening the pelvis and sacrum, we would start with the patient supine. We would check ASIS heights. He's got superior on his right side. We check pubic bone. Inferior on his right. We would check medial malleolus. They're close to even. So I would treat his right inferior pubic shear first based on these findings before I even treated the sacrum or lumbars.
If we would have found findings consistent with an iliosacral superior shear, we would have treated that first. Remember to diagnose and treat in this order. Next we'll assess the sacrum and L5.
Can kind of reset the sacrum by gently flexing the knees to allow that pelvis to even out. I like to check the ILAs first because if there's a significant dysfunction that's not a bilateral, you should notice some asymmetry. I noticed that his right ILA is posterior and inferior. I would check sacral base. He has a deep sacral sulcus on his left. I would also go up and check L5. L5 is rotated to the left, so it is a compensated L5. And we have a torsion dysfunction of the sacrum. We have you prop up on your elbows. And the findings improve. So we could use and relax, back down. Could also check springing of the sacrum, and the sacrum springs nicely. So that leads us to a forward torsion, a right on right sacrum torsion.
After diagnosing and treating one dysfunction in this order, you would go back and reassess your area of greatest restriction and your standing and seated forward bending tests to see if further treatment of the sacrum and pelvis is warranted. If you still have restrictions or positive standing and seated flexion tests, continue to work down this treatment order until all findings normalize. If you find the area of greatest restriction in the lumbar vertebrae, and this restriction is greater than that at the SI joint, then you want to diagnose the lumbar vertebrae using triplanar diagnosis and treat the worst dysfunction.